Being able to communicate with medical providers is really the first rule of preventive care. Language assistance, like preventive care, saves money and lives in the long run. And we know that some states already recognize their responsibility to pay for language access, along with the simple moral responsibility that exists to provide equal access to health services. In New York State, for instance, the legislature in 2007 included a $38 million allocation for hospital services and a reasonable accommodation for all Medicaid patients that need language assistance when seeking care in non-public hospitals in New York City. But because reimbursement for language assistance is still inadequate and its availability is far from uniform, there is much work to be done. At Language Line Services, we employ more than 5,000 interpreters worldwide, with many of them trained and tested to provide quality interpreting for healthcare customers. We hire on average 60 interpreters per week, and by 2010, we will have almost 10,000 interpreters around the world. Our interpreters speak more than 170 languages. We certify through Language Line University in 22 languages, and our list continues to grow. We also provide training and other educational resources to hospitals' internal language access staff and have long promoted the importance of clear standards to strengthen the value and effectiveness of interpretation. But for all the numbers and statistics that show that language is a growing field, for all of the data and research that prove beyond a doubt that more and more people in this country will need interpretation services, I am most struck by the individual stories that I hear from interpreters on the job about limited English-speaking patients who are helped. Stories of crises averted and problems solved. That is why I think that our job, above all, is to continue to talk, to tell the stories that show what medical interpretation achieves for patients and what its absence will mean in terms of financial and human difficulties. If we can effectively equate medical interpretation to the medical benefits that are achieved for LEP patients, I believe we will be further down the road to a higher level of quality and equity in care. Language Line Services is talking and spreading the message of the good work medical interpreters do every day in big and in small ways. One example is the recent podcast on patient safety we recently participated in with Isabel Rocha from IMIA, Dr. Ann Good of the Joint Commission, Sandra Sanchez of Grady Health Systems and Language Access Consultant, Linda Joyce. I hope that you'll go to the IMIA website to see that. Another example is our soon-to-be-launched online registry of certified medical interpreters, a free industry resource open to all organizations, which we hope will raise the profile and understanding of the importance of the medical interpreting profession. By talking and telling the stories of medical interpretation, both good and bad, we can begin to show why providers should not make do with using untrained bilingual staff and family members or others not qualified to be precise and accurate in a medical interpretation setting. We can demonstrate together that it is not acceptable for a hospital to trade quality for cost. We can explain the importance of the medical interpretation profession in a way that will ultimately increase the value of your work and, of paramount importance, the availability of new jobs. To do this, we must all take on a stronger role as individual advocates within our hospitals, within our associations, and within our community. We need to let our states and federal policymakers know that on a financial and human level, it simply makes sense to improve access to health care all around. Medicare, along with state Medicaid programs and private insurers, need to prioritize funding for language assistance. It's time to reimburse for trained professional interpreters who serve as the lifeline between patients and doctors. In this campaign season, words may seem like hot air, but in the healthcare setting, they are as vital as oxygen. That is our message. We at Language Line Services intend to carry this message of vital oxygen all the way to Washington, D.C. I know all of you support us on this important journey. I believe we are together in this sea of change. Now, ladies and gentlemen, this may come as a surprise to some of you, but I am not running for the President of the United States of America. I am, however, an American president running the world's largest language access company. And as you know, we have many, many interpreters, a good number of lawyers, lobbyists, and publicists. And if I have to, I will take every one of them with me to Washington, D.C., and I will invite each and every one of you here in this room to plead our case together. Whether it is an Obama administration or a McCain administration, they will be hearing loud and clear from all of us, and in 176 languages. This country deserves, actually mandates national medical certification, and we are going to get it. As the eldest son of immigrants from Italy and Ireland, who just happens to speak 6 languages, and who happens to have studied 11 languages, and who happens to have the responsibility of so many of our employed interpreters in this industry wanting certification, failure is never an option. It is not even open for discussion. I told you last year at this time that I was serious about national medical certification. We sponsored our second May 1st National Medical Certification Symposium for all stakeholders in Portland. And at that meeting, I announced a global advisory council funded by a grant from Language Line Services with 15 subject matter experts from all over the world. I also announced that this would be an annual event hosted by Language Line Services, and we would work together to seek the appropriate proclamations announcing that special day. I will tell you that this year, more progress has been made with IMIA and Language Line University's Global Advisory Council on the topic of national medical certification than has been done in the last 15 years. Please join me in giving Isabel Aroca and the amazing members of the IMIA team a great round of applause for their leadership, bravery, and persistence on this important initiative. I'm also proud of the role Language Line Services plays in our mutual endeavor to eliminate language barriers. To me, our work is not really work at all. It is a pursuit, it is a passion, and it is a mandate that must be carried out. Today, the country is in a state of financial crises and political change. Through this time, though, we all need to be clear about our goals for change, our national push for quality initiatives, certification, and our advocacy of funding for medical interpretation. If we all continue to use our voices, I strongly believe we can convince more and more people that talk really isn't cheap, and that when it comes to our health, it is worth every penny. I also wish to personally thank each and every one of you for your exceptional and extraordinary commitment to your profession and being a part of this much talked about journey to national medical certification. Ladies and gentlemen, fasten your seatbelts. It's going to be a very bumpy flight to Certificationville. But after all the turbulence subsides and the jet stream winds of change are all moving in the same direction, and more clearer skies can be seen by all, I can assure you that our arrival on national certification flight number 1 will be safe, smooth, and finally on time. Thank you. May God bless America, and may God bless this country's national medical certified interpreters.